Hi everyone, I'm Dr. Daniel Serralta. I'm a colorectal surgeon here in Dubai. Today, I'm answering the question, do I need surgery for my post-pregnancy belly? No clickbait, no false promises, just the medical facts. You need to make an informed decision. If you are struggling with the decision, this video will help. Let's dive in. First, let's talk about what actually happens to your body during pregnancy. Every pregnant woman experiences diastasis recti in some degree. That's the separation of your rectus abdominis muscles. They're also known as six-pack muscles that run down the front of your abdomen. These muscles separate to make room for your growing baby. This is completely normal and necessary. The question isn't whether it happened to you. The question is whether it healed properly. Here's how to check. Lie on your back, knees bent. Lift your head slightly off the ground and feel along the center line of your abdomen, both above and below your belly button. If you can fit more than 2 fingers width into the gap, you have diastasis recti that hasn't fully healed. For some women, this heals naturally within 6 to 12 months postpartum. For others, it doesn't. And that's when we need to talk about treatment options, with when you don't need surgery. If your gap is less than 3 centimeters wide and you can perform daily activities without back pain, you don't need surgery. If you are less than 12 months postpartum, conservative treatment should be your first approach. Conservative treatment means physical therapy focused on deep core strengthening, also known as hypopressive exercises, not crunches. Those can actually make diastasis recti worse. We are talking about breathing exercises, transverse abdominis activation, and progressive functional movements. This approach works for many women with mild to moderate diastasis recti, but it takes 6 to 12 months of consistent work. There's no quick fix, and anyone promising you rapid results is not being honest. You should see some improvement in function within 6 to 8 weeks, but full healing takes much longer. If you're not seeing any improvement after 6 months of proper physical therapy, or if your gap is getting wider, conservative treatment isn't working for you. It's time to consider surgery. Now, let's talk about when surgery is medically indicated. I recommend surgical consultation when either the gap wide 3 centimeters, conservative treatment has failed after 6 to 12 months, you are experiencing functional limitations in daily activities like back pain or excessive abdominal bloating, or you have associated hernias. I want to be clear about something. This isn't mainly about appearance. Diastasis recti can cause real functional problems, lower back pain, pelvic floor dysfunction, poor posture, and difficulty for lifting or carrying. This is a medical issue, not a cosmetic one. If surgery is recommended, here's what you are looking at. There are different techniques, some of them classically involving cosmetic surgeons, which is mostly focused in removing an excess of skin and fatty tissue. But these techniques involve large scars around the belly button and lower part of the abdomen. This surgery is called tummy tuck or mini tummy tuck. However, I do a different technique, which do not remove skin or fatty tissue and has only 3 minimal scars of around 1 centimeter each. The procedure is called REPA, which stands for Rectus Endoscopic Progressive Approximation. I do 3 incisions of 1 centimeter each below the bikini line, and I bring the separated muscles back together with absorbable sutures, and usually placing also a mesh on top to reinforce the area. At the same time, I can repair umbilical hernias, which are commonly present. Recovery is easy, but needs from your cooperation also. The first 3 to 5 days, you will be carrying 2 drains, small silicone tubes, to remove the fluids and blood that can happen during the first days after surgery. You'll need 1 week of work for desk jobs, 3 to 4 weeks for physical jobs. No lifting over 10 pounds for 6 weeks. You will also be wearing a compression garment during 6 to 8 weeks to improve the results. Full recovery takes 3 to 6 months. Unfortunately, insurances don't cover this surgery. However, the cost can be reduced if you have an umbilical hernia and the insurance covers that part of the surgery. Like in any other surgery, there are some potential risks, although not frequent. Bleeding, infection, poor wound healing, numbness of the area, and the possibility that the repair might not hold long term. So how do you decide? Well, start with a comprehensive evaluation. See a pelvic floor physical therapist first, not just any physical therapist, but one specialized in postpartum recovery. Give conservative treatment a real chance if you are a candidate. If you consider surgery, get multiple consultations. Ask about the surgeon's experience specifically in this condition and which technique they are used to do. Ask about the complication rates. A crucial point here, if you want more children, wait until you are done having babies. Pregnancy after surgical repair can undo the work and require additional surgeries. I see women who are struggling with body image feeling disconnected from their bodies after childbirth. These feelings are valid and real, but surgery won't fix everything. Whether counseling might be helpful alongside whatever treatment approach you choose. Remember, your worth isn't determined by the appearance of your abdomen or whether you choose surgery or not, but you deserve to feel functional and comfortable in your body. Start with proper assessment. Try conservative treatment if you are a candidate. Consider surgery if conservative treatment fails and you have functional limitations or significant separation. Your first step is evaluation by a qualified pelvic floor physical therapist. If you need surgical consultation, seek out experts in this matter who regularly perform diastasis recti repairs. Take care of yourself and make the choice that's right for your body and your life. Thank you for hearing.